My name is Dr. Robert Stuart, and I'm a professor of medicine at Medical University of South Carolina and the Hollings Cancer Center. I'm a graduate of Georgetown University and the Johns Hopkins University School of Medicine. I first came to MUSC in 1985, and except for about a 4-year interlude in Riyadh, Saudi Arabia in the late 90s, I've been here the whole time. My main interest disease-wise is in what are called hematologic malignancies or blood disorders, and that basically are the leukemias, the lymphomas, and multiple myeloma. I also do some benign hematology, anemias, other abnormalities of blood counts, sickle cell anemia, and so forth. But really, acute leukemia is my special interest and expertise. I've spent my whole career dealing with deadly diseases and diseases for which treatment has been inadequate. So 30 years ago, an adult with acute myeloid leukemia had almost no hope of surviving more than a year or two. And I've seen that now that 40% of such patients are cured. We've not made nearly that progress in older individuals because the treatments in the past were very toxic. But we've made substantial progress. I believe that the best treatment is on a well-designed, cutting-edge clinical trial. So my other interest is clinical trials, and I'm the medical director of clinical trials at the Hollings Cancer Center. All licensed medications have been through the clinical trial process. That's the only route towards approval by the Food and Drug Administration for sale. So, this is the backbone of progress in medicine, and I'm really proud that to be doing that for 30 years and to have such an active program as we do now. It's no secret that I'm a cancer survivor, my wife's a cancer survivor. We have a very personal relationship with cancer, and I think that it certainly changed my life in a way that I'm somebody who really cares about the patient. It's ironic that I direct clinical trials, which some people regard as being mechanical and more about the science and not about the patient. But I promise you, my patients don't feel that way. They feel like they're the most important things. And I tell my clinical trial patients, who all are volunteers, that I thank them, that I consider them my personal heroes, because they're helping to make sure that treatment for my children and grandchildren is better than it is today. And I also feel strongly after 30 years that the best care that a patient gets is on clinical trials. So that's my philosophy. Most people know that my hobby is bicycling, and in 2004 I had a very special opportunity. I was one of 20 individuals selected to the Tour of Hope national team. And the Tour of Hope was a cross-country bicycle relay organized by the Lance Armstrong Foundation and Bristol-Myers Squibb Company. And we divided our 20 riders into 4 teams of 5, and each team rode every 4th leg, which was generally between 4 and 5.5 hours, around the clock from Los Angeles to Washington, D.C. in just over 7 days. And that was a daunting experience. I had to train especially hard, but I did get a chance to meet Lance Armstrong. I rode side by side with him, and all across the country we spread the message of hope, and especially hope through clinical trials.
For more information or to make an appointment, call MUSC Health at 843-792-1414.